Say 41 this morning, and new this morning, a coalition of nations leading experts in pediatric health have issued an urgent declaration. The mental health crisis in children is a national emergency. And to talk more about this mental health crisis in kids this morning, especially here in Indiana, we're joined now with clinical social worker Jenny Volker. Jenny, good morning to you, and thank you so much for talking with us this morning.
Good morning.
What has led to this emergency, first off?
Yeah, so they've cited three things. The rates of mental health diagnoses and suicidality with youth were rising prior to the pandemic. This was then compounded by the stress brought on by COVID-19. And then they've highlighted that structural racism has contributed to disproportionate impacts on children and communities of color.
What are we seeing with regards to mental health in children and adolescents here in Indiana?
So we're seeing, with regards to depression and anxiety, about 13% of Hoosier youth cope with depression and about 10% with anxiety, and that is above the national average in both cases.
Right.
So in general, what we're seeing is more youth and families seeking services, and those that are in service tend to have more severe needs than what many of us have seen in our careers.
We are all living and leading busy lives. What are some warning signs that a child is struggling with anxiety or depression that we can look out for?
Yeah, so I usually break this down into two parts, mood and behavior. So with regards to mood, looking at mood swings, maybe increased or decreased expression of emotions, feelings of hopelessness or helplessness. And then with regards to behavior, withdrawing, isolating, loss of interest in activities that the youth previously really enjoyed, changes in eating or sleeping habits, or the use of alcohol or other drugs. And what I'd like to remind people is parents are the experts on their children, so take into consideration how your child usually behaves, their usual mood, how long has this been going on, and how severe is it?
Right, being aware and paying attention to them, very important. And when you see these things, what can parents or guardians do to support the mental health of their child?
Yeah, so creating those regular opportunities for children and adolescents to share their emotions. And remember that talking isn't always the best way to share for everyone. So think about art, drawing, play, writing, music. All of those can be great opportunities. Also, I say this a lot, but it bears repeating. Adults are the role models for the children in their lives. So if we want our children to take care of their mental and emotional health, we have to do the same for ourselves.
That is so important.
Can I make one more quick statement?
Absolutely.
So I brought up suicide. I just want parents and adults to know to always take very seriously any statements of wanting to die, any suicidal statements. You can text IN to 741-741, and there are counselors there 24/7.